Welcome all of you to the channel. In today's video, we are going to discuss about the Gurugram University Mphil 2025 PYQ. So before that, if you are already a part of Telegram group, then you know this is your PYQ based mock number 3. I hope you would have attempted these questions in 45 minutes, and what is going to be your score you can check along with that in this video as well. And what is your final score you can comment down below, and you would be knowing how basic paper this was or how difficult paper this was once you have completed the video. If you are watching for the very first time this channel, make sure that you are subscribed to the channel, and after completing the video make sure that you join in the Telegram for many more crazy stuff. Okay, so that was the introduction. In this video, Gurugram Mphil Clinical Psychology paper 18th July 2025, and this paper can be availed in the Telegram group completely free. Now, question number first, but before I start the video, if you don't know about the CANF framework, then you are quite late. And if you are giving this time rinpas 2025 or you are giving ihbas 2025, make sure that you go read thoroughly with these books, because these complete 60 questions are directly coming from this complete CANF framework only, nothing apart from that. Okay, the questions are coming directly from the books which are mentioned over here, so you just need to focus, rely completely on these 4 books. Rest all is your extra materials, maybe notes, mock tests, whatever you want to give in your life, read from your life, read in your life. That is some extra material, but this is the basic requirement. If you do this much only, it is so easy for you. People are scoring highly crazy numbers, and you can also do the same. Okay, now not wasting much of your time, question number first says that the probability that the desired response will be performed is increased by taking away something undesirable whenever the desired response is made is called. Now, as you can see, positive reinforcement, negative reinforcement, all the 4 options can be read thoroughly from the C book. If you don't have the C book, join Telegram, get the free PDF from there as well. And if you are someone who like to read from the physical books, the links are given in the description. Now this is from your learning portion, that is your schedules of reinforcement. So I have told you, whenever you want to increase behavior, the positivity, you will use reinforcement, and whenever you want to decrease the behavior, you will use the punishment, depending upon the type of the stimulus, that is desirable or undesirable. You will mark positive and negative. For now, the correct answer over here is option number B, negative reinforcement. And at the end of this paper which you will receive, the answer key is also attached with that, so you can refer to that as well. Okay, now next question, when the conditioned stimulus is presented before the unconditioned stimulus, it is called as. So what is the correct answer over here? Is it forward conditioning, backward, spontaneous, or simultaneous? So from where this question is coming, this is coming from your C book, and it is coming from your NCERT as well. Okay, so what is the correct answer over here? The correct answer over here is your forward conditioning. And what is the previous mnemonic? If you are watching for the very first time, DTSB. Okay, these are the very best conditioning that happens. First of all, the delay, then the trace, then the simultaneous, and the backward in the decreasing order. Okay, so if somebody question comes, which of the following is the most best thing or best type of conditioning which you can use, you will always answer the delay type. Now next question, question number 3, the internal or external locus of control. This question is directly once again from the C book. All the 3 questions which you are witnessing right now is clearly from the C book only. Okay, Hans Eysenck, David McClelland, Herman Witkin, and Julian Rotter. So correct answer is your option number D, Julian Rotter. And I hope you would have marked all the 3 options correctly. If you have missed any questions, you are not preparing very well. If you have missed these 3 basic questions, then you need to think of yourself and prepare very well for the upcoming examinations. Okay, so Julian Rotter is written clearly in the, I guess, learning chapter, somewhere in personality maybe. Firstly, Albert Bandura will come. In the C book, you will read about self-efficacy, and after that, in this page only, you will read the external or internal locus of control by Julian Rotter. Now this is the correct answer. Moving forward, which of the following does not form a part of Gordon-Allport trait theory? Okay, so this can be read in the NCERT as well, or any other general psychology book. But the question is little tricky. Not form a part of. So primary trait, secondary trait, cardinal, and central. You all can read this. The correct answer over here is option number A, primary trait. Now, which of the following is not a part of Gardner's theory of multiple intelligence? Once again, a simple, basic, easy question. not a part of linguistic, spatial, interpersonal and emotional intelligence. So obviously you will mark option number D, emotional intelligence. So from where they are coming, the Goldman is coming, and your Salovey and Mayer, this can be read in NCERT as well. Okay. Now I hope you have marked a 5 out of 5. If you are getting 5 out of 5, it is very good. If you are getting 5 out of 4, you need to revise well again some basic concepts. Okay. Now the paper is easy till now. Let's move forward to question number 6. Syntax is. Now this question is directly again from the C book. You don't need to refer any of the notes, any of the thing which you do worry or think about. No need to do that. Just read CANF and you will clear the MPhil examination with shining and bright colors. So what is the syntax? Go and read from the C book. You will get the answer. Over here, option number A is the correct. There are 3-4 things: phonemes, morphemes, syntax, and that pragmatics. That is only what you need to understand, and you will be able to clear the exam. Now, which type of memory is also called echoic memory? Again, question directly from the C book. Visual memory, no, we will call about the iconic memory over here. Kinesis is nothing over here. And haptic memory is for your touch perception, and which is associated with which lobe? If you know the correct answer, which lobe we are discussing about when we will talk about the haptic, touch and all those things. So what is the correct answer left out over here? It is your auditory memory. Okay. Now moving forward, next question, make sure that you are solving simultaneously along the same line. Now, next question, question number 8. Upon being asked to list various uses of a bed sheet, Pyle responds a parachute, a swing, or for posing as a ghost. Here, Pyle is. Now, this question is your applied based. Okay, you have to apply some little sweet little mind of yours. You have to apply metacognition, crystallized intelligence, transformational rules, and divergent thinking. You just need to understand the concept of convergent and divergent thinking. If you know this much, we are talking about creativity and all those things. So obviously option number C, divergent thinking or divergent thinking, is going to be the correct answer over here. Not about the metacognition, we will not talk about the knowledge and regulation and all those things. Not about the crystallized intelligence, we will not talk about the GF and GC over here. Everything can be read from where? From the C book. Till now 8 questions are directly coming from the C book as it is, and yes, obviously you have to apply some mind of yours, common sense that we call. Now the number 9, the tendency to keep repeating solutions that work in other situations is called. Are these called heuristics? Are these called schema? Are these called functional fixedness, or this is called as a mental set? So what is the correct answer over here? Option number A, mental set is the correct answer. Nothing about functional fixedness where you are fixed on something that okay we can use like this only. We are not discussing anything about the schema or heuristic is we will not discuss about over here. Availability and the what one more, that is not able to tip of tongue phenomena. What that is? Availability and representative. Yes, shopkeeper is saying all the thieves are boys, I mean all the boys are thieves, representative. And the recent ICI-1 airplane crash, whatever that is, called as the availability heuristic. And now this is the interesting question, and this will need your brain to work properly. A researcher wishes, now this question is again directly from the ebook, nothing to worry about. Till now 10 questions are directly coming from the book. A researcher wishes to know whether there is any significant association. We are talking about the significant association between political choice and music choices. Which statistic should be employed to decide this question? For this, you need to understand properly about the French word noir, which means the color black. If you know this one, then you will be able to solve this question easily, because which type of scale we can associate our political choice? Obviously ratio, and music choices, obviously ratio scale we are discussing, right? If you know what I mean, then which statistic should be employed to decide this question? We can use independent subject t-test, within subject, or analysis of variance. Are we having 3 groups? 2 groups, yes, we can think of independent and within. What we have told you previously as well in previous videos about the dependent and independent sample, we are discussing about that thing. But none of the option is relevant because we are discussing about the ratio scale. So option number A, chi-square, becomes the correct answer over here because it is a non-parametric one. Okay, don't worry, you will find question about this as well, I guess in this paper only or some other paper. But yes, there is a question which of the following is a not a non-parametric one. So till now 10 questions are directly coming from not any notes which you are referring or what you are wondering. No need to refer to anything. Just read 10 out of 10. All questions are coming directly from the C book and ebook plus your little CS common sense. Okay. Now, which among the following measure of central tendency is most sensitive to outlying observation? Mean, median, mode. You can answer. These are we are discussing about the measures of central tendency. And what is the correct answer? Correct answer is your option number A, and you have to just move forward. Okay, just remember this. You just mug this up. Okay, this is mean. Let's move forward and don't waste time on such type of questions. Now, which of the following is an assumption of Pearson product moment correlation? Once again, the question is coming directly from where? From the ebook. Okay, assumption of Pearson product moment correlation directly from the. And what is Pearson product moment correlation we are talking about? We are simply talking about the small r. We are simply talking about the correlation coefficient. So obviously there should be a linear relation and there should be homeoscedasticity. Okay. Option number A and B. So option number C becomes the correct answer. C, both A and B we should be needing in this particular question. Now question number 13. Now there are only two questions which are very gem. First one is this one, a researcher, 10th number. Okay, this is a good question, difficult one in the exam hall. 13th question is also a difficult. See, this is easy one right now, but in exam hall, it is a difficult one because you have to do so much calculations. You're in a panic state. You have less amount of time, 60 minutes, 45 minutes, 30 minutes. Okay, so it becomes difficult in the exam hall. So only two questions as of now, which will make you think more. Rest all is coming directly from the books. Okay. And if I want to promote myself, I can also say that all the questions are coming directly from the CC mock test series. So you can, if you want, you can take that as well for your future examinations. Okay. But that is the promotional part. Rest simple part is questions are coming directly from the book C, A and F. Now, a normal distribution of 200 score has a mean of 30. If you have watched the complete video on NPC, you will be able to understand what is going to happen over here. Whenever there is a normal distribution, just make like this, 200 score as a mean, so mean will fall over here, I mean in the center, and you are having the mean of 30. Okay, so what does mean of 30 mean? That you have to just add 30, 30, 30, 230, 260, 290, and you will just minus 170, 140 and like that. And what is the score Rahul received? Rahul received a score of 38. Which of the following is not true of his score? Okay, if you are thinking that like this you will solve the question, then you are absolutely wrong. The question is not saying that. The question is saying a normal distribution of 200 score has a mean of 30. So what is the mean you are having? You are having mean of 30. So you will draw like this. The mean is going to be 30, not 200. They have given this to confuse you. Okay, because not everybody is going to mark correctly this question. This is the question which everyone will think, take their time and will mistakenly mark the wrong answer as well. Okay, now standard deviation is what? 4. So what you have to do is simply coming onto the black screen, you have to just do simply like this: 30, 34, 38 and 42, and 26, 22 we don't care about us, I mean 18 over here. Don't worry about this. What is the score of Rahul? That guy, it is 38. So obviously you are having second standard deviation over here. And now what they are asking is, which of the following is not true? 38, not true. His score is equivalent to a Z score of +2. Absolutely correct. This is right because Z score has mean 0 and SD of 1. His score is 2 standard deviation from the mean. This is also correct. Approximately 48% of the total score lie between his score and the mean. This is also correct because 34 and 14 is coming out as 48. That is why I have told you previously as well. If you have watched previous video, then you have to remember these numbers. Okay, so 48 is yes because we are having 2 standard deviation over here, and approximately 68% of the student scored lower than he did. No, it is not like that. 68% of the students scored lower than he did. No, obviously 50% are here, and 50 and 48 you can just assume what should be the correct answer, and that is why we will make this as option number D as the correct answer over here. I hope you got the concept. If not, watch previous videos, previous PYQs for complete detailing. A graphical representation of correlational data is called as the scatter plot because correlation is always about the scatter plot. not the bimodal distribution, not the skewed, and not the bell curves. NPC, NPC, NPC they are discussing about, and I have told you NPC is the favorite topic. Next question, next, the variable whose effect is being studied and the experimenter manipulates only IV. So option number A becomes the correct answer. A study where the researcher does not intervene is a type of answer is your naturalistic observation, but don't worry, don't read this question. It is not going to come again. Okay. But yes, read for the next time what is quasi-experimental. I hope they have not written quasi over here. Quasi and experimental study, you will know obviously it will intervention will be there, correlational study. Just for the next time, just read what it is and don't worry about this particular question. Okay. Now, when a researcher wants to compare the mean of two groups, which type of significant test is best suited? Mean of two groups: ANOVA, t-test, factorial design, or regression. Obviously whenever there are two, you will use the t-test. This is for the interaction and this is for something else, and ANOVA is for your third criteria. Now, which of the following can reduce experimenter bias? None of the question is coming out of your the CANF framework. Okay, I will not iterate again and again this thing, but just to get you clear, just read CANF. You will not need anything in your life, obviously this channel. Now, 19, which of the following can reduce experimenter bias using control? This is very IMP. If you will read it about demand characteristics, you will understand completely what is demand characteristics, and from where you can read about a book. Barnum effect, no, it is double blinding which will reduce the experimenter bias, because the experimenter is also biased, not biased, blind, and that subject is also blind over here. Now, the Minnesota multiphasic inventory yields score on how many clinical scales? This question is directly from the ebook. Directly from the ebook. Okay. Now, which of the following indicates, and if you don't know the answer, go and read. You will find complete detail about MMPI, MMPI-A, whatnot. Which of the following indicates how well a person performed on an IQ test relative to. We are talking about the relativity, and that is why deviation IQ came into the picture. Okay, both A and B, no ratio IQ. What is ratio IQ? IQ is equals to MA upon CA. I guess this is the ratio IQ formula. If I am wrong, please comment and correct the correct formula for ratio IQ. Now, question number 21: a test coverage of the particular skill or knowledge area that it is supposed to measure is called as what? It is called as the content validity. Everything is coming from the book only, nothing apart from there. Now, which of the following is not a type of reliability? Test, retest, split half, alternate form. We have discussed about this thing in previous videos, and this is the most basic question and item difficulty. So what do you think is going to be the correct answer? Obviously, it is your item difficulty, because we will discuss this in the I mean item analysis, not the reliability portion. Question number 23, a test is constructed by including items that differentiate between addicted group and normals. The test therefore relies on the concept of good question once again. Third question that is very interesting and a good question. Okay, predictability, construct, concurrent, and none of the above. Option number C is the correct answer. For the next time, if you have missed this question, next time read more about this. Which of the following test result is based at least partly on Holland's model of occupational themes? And interestingly, it is Rorschach, Blackie pictures, thematic perception, and strong Campbell interest inventory. Option number D is the correct answer. And question is directly from the ebook. You will never read about Holland anywhere, but you will read in this book and about SVIB, strong Campbell. Now, next question, next 25, which type of neurons id called efferent neurons? Which type of neurons id called efferent neurons? So let's take psychoanalysis into picture, because the question is asking about the id. It is not id. Sensory neuron, motor neuron, interneuron, and none of the above. Okay, so this is efferent neurons, and whenever you will find such type of questions, you have to just generalize where you will find the maximum, and it is your motor neuron over here. Okay, efferent neuron, which type of neurons it is called efferent neurons? So generally we are having motor neurons as the efferent neurons, because it will exit from your brain, from your CNS, and it will enter, will be called as the efferent neurons, that we will refer to as the sensory neurons. So next time make sure that you are awake and alert, because this question is IMP and will repeat again. Sensory neuron generally afferent, and this is generally efferent. Okay, but yes, debate can be done and you are more welcome to debate, but it's completely okay. And yes, thank you. And next question, parasympathetic and sympathetic nervous system are a part of your CNS. Obviously not. Somatic, no, it is your autonomic nervous system. CNS consisting of the PNS, S and A. Which neurotransmitter, and this is a PYQ repeat. I mean the top one was also the PYQ repeat. And now the next one, which neurotransmitter is responsible for parasympathetic response in the BUSI? So acetylcholine, dopamine, serotonin and epinephrine. It is your option number A, acetylcholine, the correct one. Now, this is once again a good question. 28, okay, not this one, 28. Reticular formation extends from this one. Good question. The fourth question is the good one. I mean, the fourth question, which is interesting and tricky. Forebrain to midbrain, hindbrain to forebrain, hindbrain to midbrain, and left hemisphere to right hemisphere. And it extends from, if you know the functioning of the reticular formation, what it is used, RF, then you will answer option number C. Rest all, it is a good question. If you read from the C book, question is directly coming from there. To the following endocrine gland affects metabolism rate. A good question once again, but we will not include as the fifth one because it is a general question. Adrenal gland, why it has to do with your metabolism? Hypothalamus, is hypothalamus what? A gland? Please comment if it is a gland. Okay. Ovaries, obviously not. The thyroid gland is the correct answer. Thiamine and all those things is IMP. Question number 30. Who gave the opponent process theory of color vision? You read anywhere. The question is coming directly from the C book. Young Helmertz, Ewald Hering, George Beakley and J.J. Gibson. You will read, find out. Option number B is the correct one. Stanley Milgram is a pioneer in the field of obedience, conformity, compliance and social learning. See, social learning coming into picture. Albert Bandura is smiling from the sky. Compliance is Robert Cialdini, and conformity Solomon Ash, Muzaffar Sharif. Obedience is your Stanley Milgram. Next question, the tendency that over time the persuasive impact of a high credibility source decreases while the persuasive impact of a low credibility source increases is called as the reciprocity, social exchange, placebo, sleeper effect. And this is a good question, so we will include this as the fifth one, a good question which will make you work. Reciprocity hypothesis, no. See, obviously you will not mark the social exchange theory because it is by Thibault and Kelly. You will not mark this. Reciprocity hypothesis is obviously not the answer. Placebo, you know, you have studied about research, you know that placebo is not going to be the answer, so it eliminates out sleeper effect as the correct answer. Now moving forward, if Sohail like Rajat, Rajat like movies and Sohail hated movies, the relationship between them is in a state of, and it is once again a question from your NCERT and from your C book again and again. Balance, we are discussing about the POX model over here. So what is the correct answer? Option number B is the correct answer. Now talking about the Electra conflict occurs during which stage of development and which every student sitting in the exam hall will mark correctly. So if you have marked this question incorrectly, then this exam is not yours. You have to give it next time. Option number B, phallic, is the correct answer. The zone of proximal development, option number D, no. C is the correct answer. I have told you ZP. These are the favorite topics. In every entrance exam of MPhil, MA, whatever you are doing in your life, these will come again and again. An important feature of cognition during the pre-operational stage is centration, object permanence, primary circular reaction, none of the above. Everything is from the mnemonic called as the SPCF. If you know the complete understanding what is happening in these stages, you will mark option number A, centration, because it happens in the second stage called as the pre-operational. See, every paper, Erickson's stage of conflict encompasses physiological revolution, which among the following, every paper is having this question rooted in that. And what they are simply asking is your what? They are asking your adolescence. Physiological revolution happens majorly when you're not a child, you're an adolescent. Initiative versus guilt, option number B is the correct answer over here. The neonatal reflex, where the infant toes automatically spreads apart when the soles of their feet are stimulated, is called as the, everything is given in the C book. Rooting, Babinski, Moro, grasping, you will read the box. Everything is given over there. Correct answer is your option number B, Babinski. Now the term holophresis. Now this is the sixth question that is interesting, and I think you will not find in the book directly, but yes, this is a 6 good questions they have framed. The term holophrasis means a toddler use of single word to express. Now here comes the learn, because option number A is the correct answer. For next time, maybe rinpas, ihbas, this question can come. The term holophrasis means a toddler's use of a single word to express a complete thought. Milk, I guess, is a holophrasis because we are discussing about a toddler's use. Okay, so 39A is the correct answer. And what you are going to solve? Who gave the learned helplessness theory of depression? Nobody will answer it wrong. Why we will discuss about therapy, aggression. Martin Seligman is the correct answer. Now option number D is the correct answer. Martin Seligman. This guy started in 1998. Positive psychology. Had written the book Authentic Happiness. Talks about values and action. Talks about friends of Mihai Csikszentmihalyi. Discussed flow with him, and many more things about Martin Seligman to explore to you. Now, next is 41. A key feature of which is that the therapist might challenge an irrational belief. As soon as you will read about irrational belief anywhere, any day in your life, there is only one kind of therapy that is going to come into the picture. The client has helping her recognize these beliefs and change them into more rational ones: behavior, rational emotive, cognitive behavior, and the psychoanalysis. So correct answer given as option number B, rational emotive behavior therapy. Read from the general psychology books. You will get to know what is happening over here. Okay, therapy is very IMP. If you're interested, then we'll discuss in our future videos about therapy. And which of the following is a range of, now this is a good question. 42 is a good question. Which of the following is a range of neurodevelopmental disorders characterized by impairment in social skills and communication skills as well as by repetitive behavior? Okay, no, this is not a good one. This is a basic one. Okay, attention, ADHD, impairment in social skills, manic depressive, it is your autism spectrum. In C book also you will find, in N book, in F book you will find this thing about autism spectrum. This is a general question, not a good one. Okay, so till now only 6 questions are which are interesting. The term schizophrenia was coined by, taken a complete lecture on this. Eugen Bleuler is the correct answer, was coined by him. David Rosenhan, no. Thomas Sage, no. He talked about psychoanalysis or what? Something I'm not able to recall correctly right now, but yes, something he has to do. This is a good name, Thomas says. If you know, please comment down below. False beliefs discordant with reality that are maintained in spite of string or strong evidence to the contrary are called as hallucinations, delusions, hypomania, and agoraphobia. Coming from where? Coming from the N book, the F book, and the C book. Hallucinations, option number B, delusions. Okay, this is taken from where? Taken from the schizophrenia. And if you want to understand completely about schizophrenia, I will do what? There's a movie called as A Beautiful Mind. You can watch that and never forget about schizophrenia, how real it can be. Okay, and don't worry, after 30-40 years you will find this happening in our India as well, because we are learning from West. And Tourette disorder is characterized by, this is question directly from the F book. Options are multiple motor tics, one or more vocal tics, both A and B, and repetitive compulsion. Option number C is the correct answer. This is a good one, good question, question number 7. But those who have read from the books thoroughly, obviously they will mark the correct answer. Flat effect, N book, F book, coming directly from these two books. Okay, flat effect, which is characteristic of schizophrenia, is flat affect. Okay, my bad. Flat affect, severe reduction in the intensity of affect expression, a phase characterized by poor adjustment. This is a good one, not good one, general question about schizophrenia. Okay, you should know virtually no signs of affect expression. Okay, this is not a good one. Only 6 so far. So now sometimes a person with schizophrenia, direct question from N book and F book. Okay, see, what I can do is I can also make some quick little notes, and I will also say that okay, read these notes. And no, don't go for notes. I mean, it's totally a personal perspective, but when you read books you get more insights as compared to any notes. But yes, quick revision, notes is helpful. But sometimes blunting, no. Neologisms, prodromals and catatonia. Option number B is the correct answer, neologism. Which of the following is not true about the diagnosis of major depressive disorder? Major means major, grand, big. Depressive means depression, and disorder is a common disorder. At least 1 week period of prominent and relatively persistent depressed mood. And even if you don't know, not read about this question, you can just apply some common sense what is going to happen. Okay, we are discussing about a major. I hope you know the distinction between minor and major. Okay, if you know between minor and major, you can apply some common sense over here. Loss of interest in all or almost all activities. Okay, we can say this is true about MDD, major depressive disorder. Appetite or sleep disturbances, yes. Feelings of worthlessness or excessive guilt, yes. These three are correct, but just read the first statement and it is shouting at you that okay, mark me, mark me, mark me, and you are wondering what? At least 1 week period of prominent and relatively persistent depressed mood. Okay, so let's suppose this is a clinical psychologist which you are going to become shortly, and someday someone comes. Let's suppose I am coming to you and I am telling you that okay, I am having 1 week period of prominent and relatively this. So will you diagnose with me as a major depressive disorder? Ask yourself. You got the answer. Let's move forward to the next one. Which disorder was formerly known? Yes, and there are exceptions. We are not talking about exceptions. We are talking about the general thing, which out of 100 people, what they will mark based on a general common sense. We are discussing about that, not about the exceptions. Which disorder was formerly known as dysthymia? And this is a dysthymia you will find in, you will read books, you will find in any of the books. Cyclothymic bipolar 1 bipolar 2 persistent depressive disorder is the correct answer. 50 Saurabh, and this type of question is a rare one. Okay, they have asked in this exam. It is likely not possible to repeat once again in Gurugram Mphil, but yes, in other Mphil also I don't think this such kind of question is going to come for you. Now Saurabh mistakenly believes that his upper body is misshapen and ugly. He is likely suffering from hoarding disorder, body dysmorphic, trichotillomania, generalized anxiety. Coming from the books, not a good question, just a general question. Lithium is mostly used for treating. You will read N book, you will find this question directly. Okay, lithium is most commonly used for treating what? Schizophrenia, OCD, bipolar or somatoform. Option number B is the correct one. For the next time, make sure that you remember this, prepared well for these kind of questions as well. The most successful, and I will include this is a good one. Okay, it will make your mind work, think and recall properly. This is a good question. So only 7 questions which are good, rest all is copy pasted from the books. The most successful treatment technique that can be used for treating phobia. Whenever in your life phobia is there, you will mark systematic desensitization, nothing apart from that. Why Eric Berne will take his PAC, parent ego, this ego, that ego, and will treat phobia. Why we will dive into psychoanalysis and why we will use ECT. This is banned and all those things, but option number A is open for you every day. Acute schizophrenic episode most likely can be treated using with which of the following drug? Diphenylhydantoin, chlorpromazine, MAO inhibitors, L-DOPA. Now this question is again from the N book. You don't need to go anywhere, read anything unnecessary. Yeah, for knowledge you can enhance reading so many books, but to clear the exam, option number B is the correct answer. Just read minimum and score maximum. The technique used to distinguish fear by forcing clients to remain in anxiety arousing situations is called, in these all three books C and F you will find this thing, and we'll call it as the flooding, not the timeout, not the inhibition. A primary characteristic of catatonia in schizophrenic patient is auditory hallucination, paranoia, delusional thinking, motor abnormality. So whenever we will talk about catatonia, it will be motor abnormality. Option number D. Read from the N book, F book, complete detail about your psychopathology and this thing. Which of the following is not a personality disorder according to DSM-5? And this is the 8th question, which is good one. Okay, it will make your mind work. Impulsive, antisocial, borderline, and narcissistic. So you have to be aware what is happening in DSM-5. Option number A is the correct answer. If you mark correctly, it's good. If not, next time make sure that you remember this thing, that impulsive is not a personality disorder in DSM-5. It does not mean, it never implies that you will go in DSM-5 page to page you will read. This is just completely waste of time for one single question. Okay, there are 59 more which you can focus on. Which of the following personality disorder is associated with a pervasive pattern of detachment from social relationships and a restricted range of emotional expression? Once again, we are talking about schizoid, N book, F book. If you read page by page, line by line, you will get all these easily. Which of the following is not a symptom, and those who have done, they are scoring high. Which of the following is not a symptom of dissociative fugue? This is given in the N book, C book about fugue. You will find a sudden unexpected travel away from home, identity confusion and hallucination. Option number C is the correct answer about hallucination. Pooja witnessed brutal killings, screams of children. This statement is telling you the answer. The likely possible answer is going to be PTSD during war. You don't even need to read what is happening over here. Why? Because Pooja witnessed brutal killings and screams of children during war. So obviously she is now grown up. After returning, she suffered from recurring haunting memories and nightmares and all these things. Obviously not dissociative, not a GAD. It is a post-traumatic stress disorder. Coming forward to the last question, Suraj is experiencing sudden episodes of intense dread along with shortness of breath, heart palpitations which come and go. He is most likely suffering from. He is most likely suffering from the panic disorder. Okay. All right. So these were the all 60 questions that you have just witnessed from 18th of July 2025 paper of Gurugram Mphil Clinical Psychology entrance examination. If you want these 60 questions with yourself, you can just simply join the Telegram channel from here, and there you will have this 12 page of PDF where you will get the 60 questions along with the answer key absolutely free in the Telegram group. So you just have to click on the link given in the description and join from there. If you want to know about the CANF books, you can just go to the link given in the description and you can read about those, what are these books, and I am telling you questions are coming directly from there and it will keep on rolling again and again. If there are any changes, make sure that you are subscribed to the channel so that you get detailing, complete, minute detailings about that. You don't need to refer anything in your life if you read proper from the books. Okay, you have to just read once, clear the entrance exam, and then become a clinical psychologist. So why not take pain right now, read everything that is there and just clear the exam ASAP. Alright, so thanks for watching the video. I hope you like the video. Make sure that you are subscribed to the channel and you are joined in the Telegram group as well for quick updates and all the materials and all those things you can refer to. Thank you and have a nice day ahead. Wish you all the very best who has given this examination. The best of you will succeed, and those who have missed by 2, 3, 4, 5 marks, whatever their marks is, prepare very well for the upcoming examination. Currently examination going shortly is rinpas 2025, ihbs 2025, and 50 to 60% questions from here which we have discussed are going to come again. So 60 questions, just mug it up as it is repeatedly again and again. You will find wonders when you will sit in this examination. Thank you and have a nice day ahead.